My name is Steve Snuffer, and I am a patient at the Emerson Weight Loss Clinic, and I have lost over 235 pounds. My weight did define me. People looked at me as, he's that big guy. You know, I was always the big guy. And yeah, it does define you. You become that larger persona, if you will. People think of you as jolly and jovial, and really you're kind of hurting inside.
I'm Dr. David Lautz. I'm the medical director of the weight loss program at Emerson Hospital. So Steve had been gaining weight for a number of years, gained 10 pounds or so over the course of many years, and then had gotten his weight up quite high, so that he was really in significant trouble with his medical problems, most notably his obstructive sleep apnea, requiring CPAP masks at night to help him breathe.
Every morning I would wake up, my bones hurt. They creaked, cracked. When I played guitar, my guitar was probably 2 feet in front of me. It was resting on my stomach. And, now I can take a guitar and just pick it up and hold it close to my body and feel the music.
So when you're deciding on what type of bariatric surgery to have, there's a lot of factors that come into play. The risks and benefits of each operation is different. So they come to an orientation session where we go through each procedure and go through its specific risks and benefits, and then they can compare and contrast and see what feels right to them.
I could say as a large person or obese person, I was, kind of shy, introverted a little bit, even though I was a performer. And people were like, "Oh, you're an entertainer. You're on stage. You must have all this like charisma and confidence." And I didn't. The weight had me kind of hide inside a larger shell, and the losing the weight kind of helped me come out of that shell a bit.
In general, what I see is patients who have a laparoscopic gastric bypass will generally lose about 10% of their total weight that first month. And they'll lose about half of that the second month, and then the third month again. He's leading really a whole new life. He's much more active. Steve's doing these outdoor hiking trips that he's always talking about, is very enthusiastic about.
I remember going up the hill and stopping along the way, maybe 3/4 of the way, and looking back and just seeing the scenery, and just it's amazing to be able to have that ability to push your body.
To give somebody many of whom have had a terrible quality of life their whole life, many of whom have been treated poorly as children on up, who've had the sort of struggle that they've not been able to conquer, and to, with one fairly straightforward operation, change the entire course of all of that. That's very gratifying. And that's really what I think a lot of us in the field, why we do this type of work, because it can have such a huge impact on the quality of life of the patient.
If I was to say something to Dr. Lautz, I would probably say thank you. Thank you for helping save my life.